And joining us now here in studio is the former Deputy Premier for the province of Ontario. There's George Smitherman. Welcome back to TVO, George.
Good to see you.
You too. Okay, let's take a step back here and really go back to the beginning. I'd like to understand what the original vision for Ornge was.
Well, the original vision was motivated by improvements in patient safety. If you look at the history of medical air transport in Ontario through the 90s and before the period that I became minister in 2003, it was very often criticized by coroners' reports and auditors' reports as being a risk to human safety, especially because it was fragmented. Ministry was running dispatch, hospitals, 8 different ones were running ambulances. The original vision was to create an integrated system that could enhance the prospects for human health and safety. And I think actually lost in a lot of the debate about financial activities and such has been that I think we have a system that is world leading and that does a very good job day in and day out of providing for the people of Ontario.
So the idea was to create a company that would have a fleet of helicopters that would, in essence, transfer patients. You're shaking your head already.
Not a company.
An agency of the government.
Well, yeah, a not-for-profit entity, like in the same way that a hospital is a not-for-profit entity, which has the motivation of enhancing patient transfer capacity.
And on this patient transfer issue, basically 90% of what it did was not transfer patients from an accident scene to a hospital, but basically hospital-to-hospital transfers, that kind of thing.
A lot of it, you have to recognize that because of the breadth of Ontario, the sheer size of it, a lot of the transfers that Ornge is involved in are from isolated First Nations communities in and out of healthcare service establishments. So that's a big part of the business that they do. And of course, responding on scene to highway accidents, to water incidents and this kind of thing is also a substantial bit of that focus.
And the plan was to cover the whole of the province of Ontario?
At the time that I became minister, because of the age of the fleets, the amount of fuel that they use, where they were stationed, etc., there were gaps. Like I know there was a part on the Highway 11 corridor in Northern Ontario, say around Hearst or what have you, where Ornge, then Air Ambulance Services, had a difficult time covering those areas. So we were obviously looking to enhance the capacity to serve all parts of the vastness of Ontario.
Okay, at some point, and I hope you can help us sort of get behind the scenes here, at some point this company decided that it wanted its organizational structure to be different from a typical agency of the Ontario government, insofar as it would have subsidiaries that would have for-profit elements, not-for-profit elements, a charitable foundation as part of it. How did all of that come together?
Well, I think that on the focus on all of this complex web of private entities, this is mostly the mischief work that the board and the CEO, I think with the support of outside lawyers, got up to after I had exited the scene. But with respect to the charitable foundation element, that was part of the model that emerged. The rationale was, like I mentioned before, to be similar to hospitals. Not that it would be that a substantial portion of the funding would come that way, but it seemed like there was an opportunity to leverage some philanthropic support to enhance the capacity of that entity to provide good service. And in Alberta, their air ambulance system, which is nowhere near as robust as Ontario's, does enjoy a lot of community support, and that's the model from the standpoint of the charitable activities.
So when you were there, did the nonprofit and for-profit subsidiaries, was that a part of the picture?
I don't think that there was for-profit subsidiary activity to the very best of my knowledge at that time. The focus was on the integration of all of the aspects of service. Tony Clement had started that when I arrived at the ministry in 2003.
Former Conservative
my predecessor, health minister. He had integrated the programs. It used to be that there were 8 different hospitals and each one of them had an ambulance in an air ambulance in its budget. Tony Clement had unified those, created one program run out of Sunnybrook, and Dr. Mazza, who had been running the Sunnybrook program since 1996, emerged as the leader of this integrated aircraft. What we sought to do from the standpoint of patient safety, as I mentioned, coroners' reports had been critical about that, was to also integrate things like dispatch so that there was less prospect of miscommunication and therefore lost life.
But as far as you know, you left what, November 2009?
June of 2008.
June 2008, you left
the Ministry of Health.
And November 2009 you ran for mayor.
Exactly.
Okay. As far as you know, as of June 2008, the organizational structure of Ornge was, let's put it this way, simpler as opposed to the more complicated entity it became?
100%. Yesterday I said, you know, I've been a bit peeved by this reference in the Toronto Star repeatedly to being the architect of Ornge. And what I said yesterday is I think more appropriate to say I was the architect of the ranch bungalow, and subsequent to my departure, they wanted to add a great hall and some guest suites and a whole bunch of other stuff. And frankly, more recently, when I've seen this complicated web of companies and the interrelation amongst those things, bears no resemblance to the model that I was in favor of and that I worked to implement. The focus, as I said, was on patient safety, coroner's reports all through the 1990s, and auditors' reports as well, highlighted risk to human health, and that was the motivation at the time for integrating these services.
So the model that you took to Cabinet was a simple, we're in the helicopter business, we may have a charitable foundation, but all of these for-profit ventures on the side and so on, that wasn't part of your vision.
Exactly, and really, in a certain sense, through all the decisive actions that Minister Matthews has taken, we've moved back to that. We've moved back to that, pretty much to that fundamental model.
Okay.
We did one more thing, which is that because if you think about it, what we have here is the capacity to have airborne ERs. These are not merely transport vehicles. These are mobile healthcare provider spaces. And we had a situation very often where a patient, a critical patient, would come in to, say, an airport and would then be transferred to a lower standard of care in a traditional land ambulance. And in those places where there was a high volume of critical care transports, and the municipalities really struggled to do that service well, we put a few specialized ambulances on the road. I think that's been criticized somewhat today also by the auditor, as I understand it, but I don't think that they've understood the motivation there, which was continuity of care for some of the most critically compromised patients that the healthcare system knows.
I get that. I'm pretty sure yours is the signature on the original performance agreement, though, that the Ontario government signed with Ornge. So this is the relationship I want to understand better. Did they come to you, I guess it's Chris Massett, did he come to you at any point and say, I want to have all of this extra private sector activity on the side, can I get that into our performance agreement?
No. The motivation, as I mentioned before, was with these two elements. Integration of services, especially because we had dispatch and operations in different places, getting it all under one roof, and the charitable aspect that I spoke to, which was always expected to be in the grand scheme of operations, a minor opportunity to augment public resources with some philanthropic support from the community.
Okay. Do you have any problem with Cabinet getting it through?
No, I don't recall. This thing, if you look at it in its history, this thing has been more studied, poked and prodded than just about anything I was ever involved in as a minister. And as I was exiting the ministry, I think it's noteworthy that you had the Public Accounts Committee, which is chaired by an opposition member, take a look at Ornge. You had a follow-on review, a 2005 auditor's report and a 2007 follow-on review from the auditor, and also the Ministries of Health and Finance sent in their own independent audit just a few months after I left. And presumably all of these reports were an opportunity to highlight deficiencies in that performance agreement, and I've never been made aware of any desire to make alterations to it. Certainly at any time that a government or a minister had a desire to make improvements there, they had many different levers at their disposal to do so.
So who was the Minister of Health at the time that Ornge transmogrified into this entity that it seems a great number of people have a problem with nowadays?
Well, I don't know the answer to that. I don't have access to information that's any greater than yours. I'm gathering information from the media. Many of us learned a lot about it from this January 2011 letter. But to me, the bigger question is, was the ministry, it's easy to talk about a minister, but the Minister of Health, this is a bigger enterprise than the government of Alberta.
No, it's a $47 billion business.
There's 400,000 direct and indirect employees. On a day-to-day basis, of course, no minister or the few staff that work alongside him or her are able to be the oversight. The question that I have is really of the ministry, of the bureaucracy. When did you first learn about challenges where you thought that the performance agreement wasn't sufficiently protecting the taxpayer? And what steps did you take then? Why weren't there efforts beforehand to bring this organization to heel?
Okay, but the auditor did say in his report and in his subsequent press conference that he thought that the original performance agreement that you had signed with Ornge was badly lacking and needed significant improvements.
Well, he's saying that now in 2012, but he didn't say that in the report that he authored in 2007, where he actually looked at the same performance agreement. So I get that everyone's now on this point. Oh, well, if only we'd known. But the fact of the matter is that well before today, some people in the ministry must have concluded that this performance agreement had some deficiencies. And where were the actions that they took at that time? I think it's frankly a little bit too convenient to merely look back at that retrospectively. When can people first make those conclusions, and what steps did they take?
But when you were the Minister of Health, none of your people brought to your attention any of the irregularities that have subsequently come out?
No, and actually to the point, also learned from the media, some whistleblower fellow, I can't remember his name, sent an ill-fated letter directed to another minister that was intercepted by ministry bureaucrats, never got to my desk. In the time that I was there and to the time that I left, the focus was on patient safety, motivation for the integration of services, and as best as I know, that was very, very successfully advanced, to the point where the Toronto Star, in a 3-part series in early 2009, said very laudatory things about the model of medical air transport that had emerged in our province.
Okay, let me do a couple of follow-ups on that, because the auditor's report and the Toronto Star series have pointed out that the design of these helicopters was terrible. They were such that they weren't tall enough for paramedics to be able to do CPR on patients. And if you're a patient who's had a heart attack, the idea apparently at some point is to raise the head high enough on a 45-degree angle to prevent the blood from going to the head. Again, ceiling not high enough to get that done. Any of that come to your attention while you were Minister of Health?
Well, no, it couldn't have come to my attention. These aircraft were purchased well after I had exited the Ministry of Health. I would say one thing is that there are a lot of competitors in the helicopter space, and a lot of competitors of private enterprises that would like to be delivering these services in Ontario. And some of the sourcing on these various kind of critiques and stuff is fueled in part, I think, by competitive jealousy and tensions.
So sour grapes because they lost the deal.
Well, I think that needs to be considered as part of the motive for some of this information. What I know about those aircraft is very little. What I hear is that from an operational standpoint, they now give us the capacity in Ontario to have addressed some of those gaps, territorial gaps, in service delivery. But I know very little about their suitability. But I think that there are hundreds of these aircraft in similar service across the globe.
One of the things the auditor actually did not criticize you for, but which others have criticized you for, is the nature by which you made the agreement. You sole sourced some of this stuff, as opposed to putting it out there for tender.
Absolutely, but I think that this is the most misunderstood piece of it. We were making a deliberate decision. This wasn't about sole sourcing, this was about insourcing. We were bringing the service of medical air transport back into a not-for-profit realm from the environment of for-profit provision. Okay. And why were we doing that? Look at coroner's reports through the 1990s, where the Ministry of Health was held to account because it could not do an adequate job of holding those lowest cost operator private service organizations to accountability. So I know I saw that thing as like,
yeah, but you got to help me with this. You got to, because if you want to go build a hospital, chances are you're going to put it out to tender and you're going to take the best bid. In this case, and the auditor didn't criticize you for this.
With all due respect, your analogy is, I know where you're going with this, but you got it all wrong. You got an apple and orange thing going on here.
Pun intended?
Pardon the pun. Yeah. If you have a hospital, which is a not-for-profit healthcare provider organization. Ornge is that hospital. It is the not-for-profit healthcare provider organization. We made a decision that enterprise would have the opportunity to own and operate its own fleet rather than depend on the whims of the private sector as the operator of that fleet. And we did it with the motivation being these coroner's inquests and other things which pointed to the ministry's inability to properly regulate for-profit providers in that space.
Okay, I appreciate that.
And of course Yeah.
But to my understanding, when government procures for a good or a service, most times it puts it out for tender so that it can get a competitive bid process going so that it gets the best possible price. That didn't happen here.
Well, no, and there was no intention to make that happen. If you want to focus on the issue of tender, the more appropriate place, I would argue, to ask that is with respect to the procurement policies related to the procurement of the helicopters themselves. In that case, as I mentioned before, I was pretty much long gone. And I also believe this morning the auditor has said that he found that the performance agreement was sufficiently robust on matters of expectation over Ornge on procurement.
Yes, he
so
did.
Those questions are better asked of other people, but really fundamentally, I think that there's been perhaps a deliberate attempt to confuse things here. We were seeking to create an entity which had the capacity to own and operate its own fleet rather than depend on the going out to tender and the constant risk of rejigging who's operating what aircraft from what place. It was the desire to create a unified and integrated service motivated by human health and safety, because I read those coroner's reports and I took them very seriously.
Okay. We know nowadays government wants to try to find revenue wherever it can. It's got a $16 billion deficit, and we understand that government is being urged to think outside the box to do things differently. So hypothetically speaking, would you, as health minister, have any problem with an agency of the Ontario government that came forward and said, look, we understand we're running a nonprofit service, flying people who are in trouble and who need health care from one place to another, but we can do something with some profitable subsidiaries that could actually return more money to the taxpayers here. What do you think of that idea, Minister?
Well, firstly, that never came to me. It never came to me presented like that. But let's look at a little bit of history. Firstly, all across the landscape, especially perhaps in our post-secondary institutions, we've got universities that are operating, and colleges too, I think, which are operating off of the terra firma of Ontario with the view towards, with the motivation of augmenting their financial stream. And similarly, several of our public hospitals, some of our best known ones, are operating in kind of joint venture models in other places. The government of Ontario, I think right around the time that I left, in their throne speech said, we should look to maximize the opportunities to leverage our strengths in healthcare for this kind of revenue.
So hypothetically, there's nothing necessarily wrong with what Ornge tried to do.
There's a lot wrong with the way that they went about it, and the focus primarily is on the matters of conflict of interest. And you cannot undertake such steps if you think that it's feasible to do it in an environment where you're going to have individuals that where their salary is a kind of a commingling of this enterprise or that enterprise. It was badly flawed and thought out on that basis. And I think this is really where I ask is, that board that was operating there at Ornge, I don't know all of the people there, but this was a very, very high caliber, well-profiled board.
Did you not appoint any of them?
No.
None of them?
No. And I think more to the point is we have to ask the questions is, were they deluded or delusional about the misjudgments that they made? For instance, does anyone really think it was going to fly that you would create a private entity off the reputation of a public one, pay only 3% as a dividend? Whoever cooked up ideas like that was seriously off their marker. So sure, there are opportunities for Ontario to leverage its public capacities in healthcare and education. Maybe that's right to look for those things. But I think we better get down to some core principles that guide that kind of work, because this has shown us that the intermingling of these concepts in one organization is a terrible, terrible step.
George, you told the Toronto Star that you inherited Chris Mazza, who was the guy who ended up running Ornge. and who no one's seen now for weeks and weeks. What did that mean?
Well, you know, I also said in the Toronto Star that I thought that he was an intelligent and articulate person, and that he'd gotten carried, and obviously things had gotten carried away. But you know, the Toronto Star, which I'm you know, used to carry as a newspaper boy, and my stepfather is a Star pensioner, and I'm a liberal, so I've always kind of had a pretty good feeling about the Star. I've really been pretty frustrated with the nature of their coverage, seeking to make it seem like I wrote a 200-page performance agreement, not my ministry, or that somehow I was buddy-buddy. I emerged in 2003 with the privilege of being Minister of Health in Ontario. And when you get that job, not like in the United States where you then all get to move out hundreds of people and move in your own people, you inherit the institutional memory of people that have been in jobs, in some cases for a long time.
And he was one of them.
And he was one of them.
Okay. Did you know him well?
During my time as minister, I gave that file as much attention as I possibly could. During my time as minister, as you well know, I carried forward a massive activist agenda. So I came to know him as I would of hundreds and hundreds and hundreds of other leaders in healthcare in Ontario.
Have you talked to him since he was fired?
I have talked to him once since he was fired.
Boy, we sure want to know what was in that conversation, George.
It was, you know, the fact of the matter is that I asked him about the salary matter. Because I had heard from high-ranking people in the ministry that they tried for years to find out and couldn't. And I personally find that a little, you know, a little bit implausible. Like,
well, should we do the background here? The background here is that they didn't disclose, they meaning all the Ornge people, they didn't disclose how much money they were being paid, even though they should have by law, but they said, we're getting paid by our profitable subsidiaries, and therefore the public has no need to know or interest in all of that.
Yeah. So firstly, I left the ministry in June of 2008, and at the time that I left the ministry, not only was Mr. Mazza's salary reported publicly on the Sunshine List, it was at a reasonable level of $298,000. What happened afterwards, I don't know. That did not occur on my watch. But if I was a minister and my ministry brought to me a situation where an entity that was getting almost all of its funding from us was not cooperative or was bucking the auditor in a request for information, etc., I'm pretty sure my operational style means I would have taken very, very direct and deliberate action. And I think that there are always opportunities. I referred in the Toronto Star, they said, well, the Ministry of Health was like the sugar daddy for this place. It's like, I understand there's lawyerly control, but a lot of the power that one has to exercise is not just what's written in a performance agreement.
Fund or not to fund.
It's like, oh, maybe you should slow down sending them this month's check, or however the dough flows. Yeah. There are levers that are available. And I really feel on this one that for several years, the ministry, which has many thousands of employees, was not doing good service for Ontario and did not appropriately bring to the attention of the powers that be, the ministers and such, of the need for corrective action. If we all want to say that the 2005 performance agreement was flawed, did we need till today from the provincial auditor to know that? Someone must have concluded that sooner. And I'm interested to know what steps did they take to actually bring this wayward organization back to heel.
And in fact, the Auditor General did say in his report that he thought the taxpayers' interests were not well served by the Ministry of Health, that they didn't look out hard enough. George, you and I have talked lots of politics in the past, so let's talk a bit now, okay? Should Deb Matthews, the current health minister, resign over this?
No.
Why not?
Because it's time that we actually recognize that to be the Minister of Health and to advance the agenda that's important for people means that we can't always just conclude to make the minister a scapegoat in all of this. The Ministry of Health has got thousands of employees. The minister is but one of them. Of course, ministerial accountability means a lot, but I think it's too frequently carried too far. Armed with information, which I think should have come to her sooner, but armed with information, she's acted decisively. And I think that the people of Ontario should have confidence on 2 points. Number one, that the corrective measures required have largely already been undertaken, and that nobody can overreact like a government. Trust me, they will be on top of this organization and micromanaging it in a way. You can't ask for more improvement than that which is already set in motion. I think that this is critically important. And I think that number two is that the Minister of Health is advancing an agenda very, very broad at a crucial time for the history of Ontario. And we should not operate on the idea that politicians are simply disposable. And I think that that is emerging far too much as the place where the media focuses, because it's easy, and question period, they'll all want to say, resign, resign, resign. But to what end? To the end of possibly impacting the circumstances for healthcare improvement for Ontarians.
But we have two examples here. We have the situation of Deb Matthews, who says, my job now is to clean this up. We also have the example of your successor, David Kaplan, who did resign, and resigned on a point of principle because, and in fact, much of the stuff around e-health obviously happened on your watch as opposed to his. Well, so we have two different avenues in which we could go here. Why do you think not as opposed to yacht?
Well, maybe you should be asking me whether I think that David Kaplan committed a resignable offense. It's a very difficult standard. Here's the way it works. All the pressure is built up, and then something's got to give. But they've already done the bloodletting. How many people have already been fired for this thing? And where is the ministry's responsibility in all of it? The auditor has been very, very...
You know what? There's an answer to that in the British parliamentary system. Not much. The answer is the buck stops with the minister. You're the guy who got elected.
If you want to operate on the idea that the buck stops with the minister and that the minister is personally opening every one of the 300,000 pieces of correspondence that comes into her office addressed to her, go ahead, but it's fake. If you want to pretend that I wrote the 200-page performance agreement and altered the I's and moved around the commas and stuff.
You depend on your people.
You can go ahead and do it, but it's not real. And I think at the heart of it, healthcare, that ministry and institutional memory it's very, very crucial that you have people as ministers that know relatively more than less. Part of the reason that bureaucracies can get away with stuff is that ministers, especially in big portfolios, are changed relatively too often, in my point of view. I would say to Ontarians, you want the Ministry of Health to spend your money well, and you want it to do its utmost to protect your life. And I think that Ontarians will be much better served today, tomorrow, and the day after with a minister with 2 years of expertise under her belt than some newbie being hauled in there just to satisfy the media and the opposition.
I find that an interesting position because, as you've no doubt noted, there have been elements in this Liberal government, of which you were a member, of which you were Deputy Premier, that have tried to pin this on you, that have in some respects hung you out to dry on this. What do you think of that?
Well, it pissed me off. And you know, it hurt my family. And
how did it hurt your family?
Well, you know, when you're in politics and you're a politician, you kind of, I describe it sometimes as, I knew that it was time to leave the Ministry of Health after 4 3/4 years, even though it was like the greatest responsibility and the most amazing opportunity anyone could ever be given. Because you, in order to survive in that kind of a job, the pressures of which are very, very difficult to believe, it's unimaginable in the scope, and it's about human life, and therefore every issue is not just an intellectual one; it's got an emotional element. When you're a day-to-day politician, you wake up in the morning, you look at your media, you scroll through your media to try and see what's your day going to be like. You got a bevy of staff around you that are there giving you a pat on the back or trying to arm you with the most helpful information. I left politics quite a while now. It's almost 1,400 days since I was the Minister of Health in the province of Ontario. I don't have all the trappings of support like that anymore. And when you feel like you've exited the realm of politics, but then are subjected to it, it's challenging. I think for families the same way. You know, I was wrapping Christmas presents on the 23rd of December. I'll remember this for the rest of my life, when I got an electronic copy of a Toronto Star column that was going to run the next day. And that Toronto Star columnist not only pinned the whole thing on my back, he never even had the courage or the courtesy to call me and ask me any of these questions. And in all of my life in politics, And you know, you did a hard interview with me once that got some of our mutual friends angry or whatever. I don't think I ever gave you a hard time, but I never really felt so maligned that I felt the need to do something about it. But the Toronto Star's early characterizations of my involvement in all of this, pretending that I had orchestrated all of this and that I bore responsibility for stuff that had happened more than 1,000 days after I had left the place, I really found that wanting, and it got to me. Frankly, that got to me in a way that nothing ever had before. Why would my former colleagues at Queen's Park want to do that? Why wouldn't they? It's human instinct. You want to try and divert attention and deflect it to wherever you think it could go.
You know what they're saying, though? I mean, I'm going to listen.
Well, there's they.
I'm going to tell you, there's more than one person. There's a bunch of people who, you know, in my travels down there, have said to me, eHealth, Samsung, Ornge, they all beat a path back to George Smitherman's doors, and those are the three biggest headaches this Liberal government has had. What gives?
Well,
that's what they say.
Well, I mean,
and these are your friends saying this.
Well, these are not my friends.
So-called friends.
These are not my friends. You know that that for every one of those that wants to play that storyline out, I'll bring you 4 or 5 that don't take that point of view. But you're not interested in hearing about those because it's a nice, tidy little wrap a bow on it. I could see exactly how that works. That is the instinct of government wanting to remain as government and seeking to try and deflect attention in whatever direction it can go. And obviously that means that I'm at risk because everyone knows I was active and I did things of being scapegoated for some of this stuff. But here's the conclusion that I draw. On eHealth, I was never interviewed by the auditor. So, and you know, the government's political communications allowed the auditor to roll up 10 years of spending, including that of several years of conservative spending, put $1 billion bow on it, and then allowed the opposition to make the impression that $1 billion got squandered. It's the biggest mistake of political communications I've ever seen. It's hurt me reputationally in a way well beyond any critique that I deserve. And what I concluded with respect to this matter of Ornge is that it does not serve me well to pretend that things will just blow over. So to the extent that anyone wants to talk to me about Ornge, about the motivations for it, the history behind it, what I knew and didn't know, what I did and didn't do, I think it's in my interest to go and appear. Maybe the government doesn't want to have a whole bunch of committees because, as I've said, they've already done most of the decisive actions that everyone would want them to do. But any committee that calls me, I'll be more than happy to go and to tell them as much as I possibly can. More information is my friend.
Have you at any point gone to your good friend Dalton McGuinty and had a conversation or had some emails somehow find their way to him in which you've said, look, I was a good soldier for you for a long time, and when people were trying to fire you from your job, I was there beside you. Get your attack dogs off me or you don't want to mess with me. Not in those words, but you know what I'm saying.
I don't need, firstly, no. I mean, my level of communication and relationship with the Premier has always been open, and he knows that I continue to be a loyal supporter of him and his government. I just did my income taxes. I donated $8,000 as a private sector guy. I donated $8,000 to a variety of Liberal candidates in the elections of last year. I don't doubt that in the political communications machine, there are some of those that are running that storyline, of course. And without you even telling me who they are, I already know who 2 of 3 of them are. And that's the nature of the game. But as a matter of political communications from the center of the government, no, I don't believe that from Dalton McGuinty's office that that's a storyline that they have chosen to run with. And for those reasons, I will always be able, I think, to separate my friends from my enemies, but to realize, of course, that I'm responsible for communication of my record and that I can't stand aside and let others do it. Because that's what political government forced me to do in the context of eHealth. I wasn't the Minister of Health anymore. So I wasn't the minister dealing with the auditor on a report, even though it was substantially involving my time in office. And that's not right. It's not right that an auditor's report should be written any more than it's right that a Toronto Star columnist should take me down at the knees without having actually provided the courtesy of an opportunity to respond and to provide perhaps some context and information that others wouldn't have.
Last question. Who are the 3 former colleagues who want to kneecap you? You just said you knew who they were.
I'll tell you offline. But then you'll have to confirm for me if I hit some of them as right.
Okay. We did want to invite you in here today, maybe unlike others, to find out what, if any, role you had in all of the shenanigans that have gone on at Ornge. And we're glad you took us up on the invitation, and thanks for coming in at TVO tonight.
Well, I think that rather than talking about the shenanigans only, I hope that I provided some context which shows people that the motivations at Ornge were to unify a fragmented service, and fundamentally people should have confidence that they're in a traumatic event and that they hear that the noise of a rotary wing aircraft coming, they will be well served.
George Smitherman, former Health Minister, Province of Ontario.
Support Ontario's public television. Donate at tvo.org.